My name is Stan Honig. I am a urologist at Yale New Haven Hospital, and I am one of the division chairs of male reproductive and sexual health. The purpose of this series, which is called in the month of Movember or November, is really to address the organs that are specific to men who have them or people who have them, such as the prostate and the testis and things like that. And I'm going to share my screen here for the group. And this will be the Smilow Shares program. And I'm going to talk a little bit about Movember, and the important thing here is to really know your organs. What organs do you have? The prostate, the testis, things like that. And Movember is a group that focuses on people who have these organs. And one of the focuses is that men do die about 4.5 years earlier than women. And one of the 5 tenets are listed here, which is spend time with people who make you feel good, talk more about your problems, know your numbers. So know your PSA, know your nuts, know thy nuts. So the importance of kind of checking yourself regularly is pretty simple. And move more, keep yourself in good condition, healthy lifestyles, exercise, et cetera, which is really the focus of tonight's group. It's interesting. Boys or men or people with prostates and testes, they kind of go with their parents to the doctor. And once they get to about 18, they leave high school, they kind of lose track of whether they should go to the doctor or not. And especially between the ages of 18 and 40, these people not to go to the doctor. And we've started to participate in this program, and these are some pictures from prior years of our Movember programs where people grow mustaches to emphasize the importance of people identifying with understanding their prostate and testis, things like that. And this year, instead of having a program where we brought people in, we thought we'd share some of the ideas that we thought were important to the general public. So we have a series of 4 webinars that are part of what we call Movember Mondays. The first one today is Healthy Lifestyles After Prostate Cancer. Next week will be Fear of Recurrence. In 2 weeks, we'll have Intimacy and the prostate cancer patient. And lastly, we'll talk a little bit about fertility and the cancer patient. We're very lucky to have an outstanding group of leaders in the field at Yale New Haven Hospital. And I'm going to have each one of them introduce themselves. And then after we have our introductions, we'll go in order. And each of them are going to give a little short slide presentation. And the goal here is to make this as interactive as possible. So if you're listening and you have a question, please put it up in the chat, and we'll kind of move along with each specific speaker to either have them answer questions as they go or at the end, things like that. So we have Michael Leapman, who is a urologist who specializes in urologic oncology. We have Tara Sanft. She is head of survivorship at Yale New Haven Hospital. Scott Capozza, who's a physical therapist at Yale, and Maura Harrigan, who focuses in nutrition and the prostate cancer or the cancer patient. So let's start with Mike. And Mike, maybe you share some of your slides and we'll get started.
Okay. Well, thank you so much. And it's great to see everyone. Thanks, Stan, for the introduction. I think I need your permission to
yeah, I gotta get slides. Sorry.
That's a nice way of putting it. Yeah. But so All right. Well, hello, everyone. I'm Michael Leapman. I'm a urologic oncologist and associate professor of urology at Yale School of Medicine. I'm a clinician who diagnoses, treats, and follows patients with prostate cancer. That's really my focus and I think reason for being. And so this is a topic that I'm really thrilled to talk about tonight. And I hope we can have an open conversation about this. But the question of healthy lifestyles after prostate cancer. And, we talk often about what we can do to prevent prostate cancer. We'll talk about that a little bit, as well as, the best recommendations and our current thinking about how folks who are facing a diagnosis of prostate cancer, either through their initial treatment or in their years of survivorship afterward, should think about what a lifestyle is and try to address the existing evidence that's available. So I have a few quick slides I wanted to go over just to present some of my, my thoughts and currently sort of the prevailing wisdom in the field about approaches here, and then dive into any questions. So the overview I wanted to go through today would be to, number one, set expectations for diet and lifestyle, and think about what are reasonable expectations that we can get out of embarking on a certain diet, a certain lifestyle, how that might affect our health. And just think about what it can and cannot do. I want to talk about a prostate cancer diet in terms of focusing on foods and intake and exposures that we put into our body and how that might affect the disease. Talk about the role of activity and exercise. Talk about the critical role of stress, mental health on disease and how we face it, and get into a discussion. So I'm going to be pretty brief here, but I wanted to introduce these topics. So there's sort of a growing movement to think about food as medicine, which I love, which I think is fantastic. But I think it's important to look and frame our discussion on that by realizing that food is great and it can have a vast, a big impact on us, but it's not necessarily a miracle. And we think it can have an impact, but most evidence that I'm familiar with would suggest that it can do a lot, but is not going to reverse something. And so it's important to think about those limitations. We should also think about primary versus secondary prevention. And I want to sort of introduce those themes. Primary prevention talks about things that we can do to prevent the occurrence of cancer, where secondary prevention is saying, well, once we've been found to have cancer or been treated for it, how can we prevent the cancer from coming back or change the outcome of that cancer? Another critical concept I think to introduce is that when we talk about these ideas about diet and lifestyle, it's such an incredibly complex question, and there's so many potential biases in how we study these questions. And I think that any discussion of this should, at least introduce that idea that there are a lot of things we don't know, and diet is extremely complex, lifestyle is extremely complex as well. And these strategies might impact how we think and relate with ourselves, our disease, and these uncertainties. So I want to just kind of, consolidate a few ideas. And when talking about prostate cancer diet, patients often ask me, well, what should I be eating? And I think this is something that the first thing that most people think about when they're facing a cancer diagnosis or the potential of a cancer diagnosis is, what should I do to make things to improve my outcome or to affect how things go. And it's very tempting to think about writing, sort of recommending or prescribing a certain food. And so a lot of the evidence that we talk about comes from observational studies of patients who've been treated or diagnosed with prostate cancer, and trying to piece together the pieces of what exposures they might have had that were linked to a certain outcome. And so we lack a lot of high quality randomized trials, which are really the gold standard, where we take a large group of patients and say half of you are going to get this diet and you have to adhere to it for a long enough period of time, and also have a group that doesn't have that exposure. But if we look at the outcomes of patients who've already had prostate cancer and been treated for it, the overall signal seems to be that more vegetables, tomatoes, cruciferous vegetables, and antioxidant foods seem to be beneficial. Limiting fat from red meat and dairy products seems to be beneficial. And we should try to source our vitamins from foods, vegetables, and whole grains rather than supplements whenever possible. There's a lot of interest in a plant-based diet, something that I'm personally very enthusiastic and excited by, and personally try to integrate into my own lifestyle, which seems to be beneficial as well. In terms of exercise, I think the overall message is consistency is key. And we want to think about this as really a lifestyle, something that we incorporate in our day-to-day life, and not just a burst of activity when we're facing a change in our life, but something that we incorporate in a daily basis for months and years and years. The existing evidence really seems to point in the direction of long-term exercise. And we're trying to impact energy metabolism, how we break down energy. This seems to lower inflammation and improve immune response, and could be beneficial for prostate cancer, and is clearly beneficial in other parts of our health. Studies have also shown that long-term exercise, high-intensity exercise that gets your heart rate up, can possibly impact the risk of recurrence and death among men who are diagnosed and treated for prostate cancer. So if I wish I could write a prescription for exercise, but if I would, I could. And then the question is, well, what should I do? And I think the overall message is you want to get your heart rate up, right? And you can't prescribe a certain dose, but getting your heart rate up seems to be critical. There's been some exciting research also looking at things like high-intensity interval training, which are short bursts of activity that rapidly get your heart rate up, which can seem to have an outsized benefit, and have also been linked to lower risks of aggressive cancer in some studies. And so, this really seems to be the 2 points: that number one, you want to be doing exercise consistently, and it has to be meaningful enough that you're actually moving your body, getting your heart rate up, if your doctors think that that's okay for you. So that's an important caveat, is that you want to be cleared for exercise. But as long as you've not been explicitly told by your primary care doctor or your cardiologist that you should not exercise, you should have the green light. In terms of foundations of a good exercise plan, it's critical to realize that everyone starts at a different level. So each plan should be personalized. So what's good for your friend may not be good for you necessarily. And you want to compare yourself to no one but yourself and how you did last week. So think about really only focus on yourself. And that final point is that as I say here, unless your doctor tells you not to exercise, there's always something you can do to move your body towards better health, even if it's walking around your neighborhood or even scaling up to more vigorous activity. There's no time like the present. I wanted to talk about alcohol because I think this is something that comes up almost every day in the clinic, and there's a lot of perceptions about alcohol as being possibly beneficial in our lives, that the glass of red wine is going to have an impact and make us healthier. But I wanted to invoke the statement from the CDC, which I think encapsulates the existing evidence nicely, that the less alcohol you drink, the lower your risk of cancer, period, full stop. And there's a lot of different sources of information, sometimes a lot of it sponsored by the alcohol industry, that alcohol is beneficial. But alcohol is clearly linked to at least 6 different kinds of cancer. Prostate not being one of them, but the studies tend to be mixed. And so I think the best evidence is that we should really think about moderation with alcohol, and really to max out at between 0 to 3 glasses per week, and really never on the same day. So we shouldn't be trying to binge drink or drink a lot or get that all in one day. So I'm really moving more towards pushing moderation or abstaining from alcohol if possible, because I think that the evidence really is compelling that alcohol intake really does increase cancer risk. Sleep is also important. And these can all have, also have a benefit. So just like exercise and getting your heart rate up, sleep also has a benefit. And lastly, mental health. Emotional stress is also linked to cancer development and progression, but avoiding stress is easier said than done. So it's not very clear how you should avoid exercise, but some strategies that are to come to terms and accept your stressors and not try to bury them away. Spend time in person with friends. Think about outlets that are constructive, such as yoga, exercise, or music, and not bottling it up. So I'll end there and just summarize by saying that there's no one-size-fits-all solution and there's no shortcuts. I think the theme is long-term and sustained efforts in terms of diet and exercise, prioritizing strategies that are feasible and can incorporate it into a routine. And I think that's an important point. Any plan has to actually be feasible, and the best plan is the one that you can actually do. And finally, lifestyle is comprehensive. It's not just one element. It's a combination of many things: what we eat, how we move our bodies, our mental health, our sleep, and our personal connections. So I'll stop there. I want to put up 2 resources, which I think are great. There's one from the Yale Cancer Center, which it summarizes the data very nicely. The Prostate Cancer Foundation, pcf.org, has a wonderful packet, which I would encourage everyone to try to get their hands on, which is really summarizes the evidence very nicely. And I would personally love to hear your stories and love to hear your feedback. This is my email. So reach out to me.
Thanks, Dr. Leapman. I don't see any questions in the chat. I'm just going to throw out one question. I think we'll have a lot of questions at the end, but what would you consider moderation for alcohol? You know, I think everybody thinks of that as a little different. It may be specific to a particular person, but what's your overall take on moderation?
Yeah, I mean, so I think that, less alcohol is better in general but that's a big pill to swallow to say, hey, don't drink alcohol. So I think moderation means something like, limiting it to 1 or 2 times per week, 1 to 2 drinks.
Okay, great. Thanks.
I think that's sort of a practical solution that people can follow where, if you say, look, you can never touch alcohol, but I understand that's a part of people's lives, but that's something that I think can work.
Yeah, I think we say the same thing with sexuality and reproduction. I think anything in moderation. You want to have a glass of wine a couple of times a week, that's fine. If you want to have a beer or 2 during the week or on the weekend, but when you get into really binge drinking on the weekend or kind of 2 or 3, 4 drinks, that's when I think you get into problem. I think that's kind of what you're saying, correct?
Yep,
yeah.
Absolutely.
All right, well, let's move on to Dr. Sanft. She's going to tell us a little bit about survivorship and kind of the healthy lifestyles that can help there.
Yeah, thank you so much. And I just want to say I'm so honored to be here tonight. I'm really excited. This is probably one of the few times in my career here since 2010 that I've really been able to be in the presence of so many prostate cancer patients and survivors. So I'm really honored to be here. As Dr. Honig said, I'm Tara Sanft. I'm the director of the Survivorship Clinic. And I saw that there was a question in the chat about why haven't you heard this information before? And I want to start by just saying that we do have a survivorship clinic. This might be the first that you're hearing of it. We're working on marketing, it feels like all the time. But we do have services for patients who have had a diagnosis of cancer. And I wanted to start with the actual definition of a survivor. I don't have any slides tonight, so I'm just going to make a few comments and then we can move on. But you might be wondering, well, am I a survivor because I'm in watchful waiting or I'm on treatment? And the truth is, the NCI defines cancer survivor as anyone with a history of cancer. So if that's you and you're watching this, then you by definition are a cancer survivor. And not every person identifies with that term at all. It's probably, can be a loaded term, right? It can cause some emotional reaction depending on your relationship with your cancer and how you react to that word. But it is meant to be inclusive. And essentially, I'm also the Chief Patient Experience Officer at Smilow more recently. And I believe that it's really a misnomer that it's just meant to take care of the whole patient. Because survivorship starts at diagnosis, a lot of these themes can start right after diagnosis. And a lot of the diagnostic and treatment periods are full of tests and procedures and treatments, but there's room, I think, to talk about some of these themes right away. And certainly if you haven't heard them before, it's never too late. And I think that's what Dr. Leapman was talking about a little bit in his overview. So survivorship starts at diagnosis. It's an inclusive term. It's meant to be inclusive. And, you know, there are several unifying themes. So whether or not you have prostate cancer, breast cancer, colon cancer, head and neck, thyroid, we know from the literature and from our own experience in clinic, excuse me, I have a 4-year-old who's playing hide and seek behind me, my husband. They always get active right when you have to talk. But some of the unifying themes are fear of recurrence. This is almost universal, regardless of who you are or what you've had. Concerns about late and long-term effects, and that I think also includes sexual functioning and bone health and you know, all different cardiovascular risks and future health, not to mention side effects from treatment. And then concerns about diet and exercise, which is a big theme for tonight. And you're going to hear from 2 of our survivorship clinic experts in a minute. And then, you know, the last thing I'll say is that in the survivorship clinic, you have a basically 2-hour consultation with multiple providers. It's a multidisciplinary clinic, and our entire focus is to address these issues that honestly in an everyday busy oncology follow-up clinic are often not, there's no time to go into all the details. So this is an intensive one-on-one consult to meet you where you are and hear how your life is and help make changes that are important to you. So we have a physician and a physician's assistant. We have a physical therapist who's Scott Capozza on the call. We have a social worker, and we have a dietitian, soon to be dietitian, formerly Maura Harrigan, who's on the call tonight. So I'm going to put the number in the answer part of the Q&A, I think, if I can, or maybe I'll answer. I don't know if you guys can all see the questions, but I will put it somehow in the chat so you can call us if you want an appointment, or I'm happy to answer questions about it tonight. Thank you.
Thanks, Dr. Sam. And I think that this is a unique clinic. And one of the comments was, why didn't I hear about this? Well, now you're hearing about it tonight. And one of the points that Dr. Sanft made was it's never too late. I think both Dr. Sam and Dr. Leapman said, hey, it's never too late to incorporate these lifestyle changes in your cancer care. So I think that's really the take-home message with respect to that. Next, we'll have Scott Capozza talk to us a little bit about exercise.
All right, great. Thanks for having me tonight. I appreciate it. Again, as Dr. Sanft said, I got my start at Smilow in the survivorship clinic. And so I've been able to work with this multidisciplinary team for over 14 years now, which has been great. And that working in the survivorship clinic actually was the bridge to my position now, where I'm a full-time oncology physical therapist. So I see all patients from Smilow, including individuals who've had prostate cancer. And actually, Dr. Leapman, you did a really nice job kind of setting the table for me, so I really appreciate that. You know, I'll just take a couple minutes here just to kind of expand on some of those points that you brought up a few minutes ago. That exercise and rehab should really be personalized, at least from the beginning, right? You know, especially if you're in a situation where you didn't exercise before, or maybe you did exercise previously, but you're not quite sure what you can do, you know, after surgery, maybe after radiation or after hormone therapy, you're not quite sure what your body is capable of returning to. And so, you know, rather than going on YouTube and just looking up some videos, it is best to try to start with an individualized, personalized, structured program, a rehab program or an exercise program, before you then make that leap to go to something that you might find online. And so, for me, I work in a couple different clinics throughout New Haven County. So whether it's myself or it's one of my colleagues who specializes in oncology, that's what we can do. Actually, if I can share my screen, I did find something that I did want to share with everybody. So this this graphic came out in 2019 from the American College of Sports Medicine when they did their updated guidelines for individuals with cancer with respect to exercise. And those guidelines in 2019 were much more specific than they were when they first came out in 2010. And some of the things that they talked about was that you can actually personalize our approach to exercise based on how somebody is presenting. So if their primary concern is cancer-related fatigue, the dose of exercise is one thing. If that person's primary concern is anxiety and depression, which leads to fear of recurrence, the dosing of exercise is actually different based on the research that we have now, which is great. And so again, in order for physical therapists or rehab professionals or exercise physiologists who are trained and working in the cancer world, we know these guidelines now, and we know the dosing of the exercise that we want to do. This graphic also specifically that I'm sharing right now came out as part of that report. Again, to Dr. Leapman, your point about primary prevention versus secondary prevention. As of right now, you're right. The research does not show that exercise is a primary prevention specifically for prostate cancer. However, if you can see in the corner down here, this little purple box, I feel like they kind of bury the lead here, because from a secondary prevention standpoint, as far as preventing a recurrence of the cancer, for cancer survivors, incorporating exercise to improve survival after a diagnosis of breast, colon, and prostate cancer. So we do have that research now that if you are diagnosed with prostate cancer, that being able to engage in structured exercise is going to help prevent a recurrence of that cancer. The last thing that I'll leave you with, again, Dr. Leapman, to your point earlier about, you have to be able to do something that you like. And so in order for it to be able to come an actual part of your life, to be, if you're going to make these lifestyle changes. And so again, that's my role, both in the survivorship clinic, but also in rehab, is to listen to you and find out what are your goals, what's important to you, what did you used to do that you want to get back to, what's important to you as far as getting back to it, and so figuring out then how are we going to make that work to accommodate your life. People will ask me, what's the best time of day to exercise? And I always say the best time is whenever you can find time, right? If you're working full time and you've got kids at home, you've got to get creative. And so I can help you get creative to find those opportunities to try to infuse exercise into your life.
Thanks, Scott. That was really very valuable. One question that kind of interests me is you were talking about kind of secondary prevention or prevention of recurrence with prostate cancer. Dr. Leapman was talking about this high intensity exercise. Is there anything specific for the people that are listening today that you might recommend a particular type of exercise, make strength versus cardio, or is there anything that's been shown more or less than others to make a difference?
Yeah, that's a great question, Dr. Honig. And again, I do think it's relatively personalized. We know for example that men who are on the hormone therapy, the ADT therapy afterwards, it can lead to muscle loss. And so strength training is going to be very, very important to be able to maintain function. So if I'm working with somebody and I know that they're on that hormone therapy, then I'm going to put a lot of my focus on strength training. If I get somebody who comes in and they say that they're really fatigued, I may try to do some high intensity interval training with them. I may put them on our step machine, or I may put them on our treadmill, and we may start with 20 seconds at a time, or we might start with 30 seconds at a time, 30 seconds on at a higher intensity and 30 seconds of recovery. And so that's been shown to be very valuable as far as being able to combat cancer-related fatigue. So again, that's why you want to start with a physical therapist or an exercise physiologist who specializes in oncology first, before you then kind of go off and do your own thing.
Have you seen the value of seeing patients either before they start therapy, or do you usually tend to see them after? In other words, I've started to see patients regarding intimacy issues before they've had surgical treatment or radiation. And I think it just allows the patient to get a sense that we're here to help them. Do you ever see people before they start therapy, or is it typically after therapy that you kind of get involved?
That is a fabulous question. I'm so glad you asked that, because what you're getting at there, Dr. Honig, is something that we call prehab, right? So instead of being reactive in rehab, we're being proactive ahead of time. And so you're right. If we are able to see these patients before they start surgery, before they start any kind of active treatment, and before they start hormone therapy, especially if somebody is already not in the best shape, then we're able to help them get stronger and to be able to start to plant those seeds of exercise and those lifestyle changes early on. And so, yeah, we talk about that early intervention. And I also think it's very valuable for us as clinicians that we get that baseline data before somebody undergoes treatment, because then we can truly say, well, before you started treatment, you were here, but now after treatment, you're down here. So we know what we have to work towards to try to get you back to where you were functioning previously. So yes, that is a fantastic concept. And so, yeah, for you, Dr. Honig, for you, Dr. Leapman, for you to get those patients to us soon or early before they start active treatment, yeah, we can get this ball rolling and it'll be great.
All right, that's great.
Can I just make a comment there that, there's this sense in survivorship that after you've been diagnosed and treated for cancer, you have a new normal and you're living with all these upside down abilities and side effects and things. And like really the whole idea here, and that Scott's describing and that the field of survivorship is moving to, is the preventative side, and to try to impart these interventions that we've been doing after treatment earlier, so that we don't have a new normal, we just have normal as much as we can. So yeah, I think that we're really trying hard to emphasize the earlier the better.
Mm-hmm. And I'll just really quickly, I did see a question pop up in the Q&A. If exercise will reverse fatigue that's associated with prostate hormone therapy. And I would say yes. I know it sounds counterintuitive that if you're tired that you don't want to exercise, but what we're trying to do is we're trying to create a new cycle. And so it's a little bit of exercise to be able to start to release those endorphins, right? And also, again, a lot of it is goal setting too, is to say, what are your goals? Is your goal to be able to play with your grandkids, on the weekends? Or is your goal that, you want to be able to finish that retirement home that you're working on, right? So whatever that is, like, we use that to help set those short-term and long-term goals. But yes, the way that exercise, again, is able to fight inflammation, and you just feel better too when you do it, right? So yes, we have research that shows that that exercise, a structured, consistent exercise, can reduce cancer-related fatigue.
Great. There are a couple more questions that I'm going to just table so we can have Maura Harrigan give her talk on probably the most important thing that we'll talk about, which is what we should eat and what supplements are valuable to us. So thanks for joining us.
Oh, thank you so much for having me. And I'd like to say, Dr. Leapman, I'm going to make you an honorary dietitian. That was very good. That was very good. And also, I'd just like to start out by saying, you know, working with Tara and Scott over all these years, I think our mission is to integrate nutrition and exercise into cancer care, definitely at the time of diagnosis. And that's what we're all working towards. And we often say to our patients, you know, how you eat and how you move your body is really your contribution to your care, because these are the things you can do, and they help you feel better, as Scott was saying, feel stronger, tolerate your treatments better. So that's kind of our ongoing mission, is just to keep moving nutrition and exercise further upstream into the cancer process, cancer treatment process. So I'm going to do I have some slides, and if I can share my screen, which I hope I can do, I want to highlight some of the counseling points that are most common. Here we go. So just so I often hear from people, there's so much conflicting nutrition information out there. We don't know, nobody knows what it means to eat well. And I hear that often. And I have good news for everyone. We do know what it means to eat well. It's just most people don't do it. And most people don't know what that is, because most people get information about nutrition from the diet industry, which is a business. You know, the South Beach diet, the keto diet, the grapefruit diet, where what we need to do a better job is educating people on what we call evidence-based nutrition. What is it that we know from research that benefits the body? And here is this beautiful document, and it's put out by the World Cancer Research Fund, American Institute for Cancer Research. And it summarizes all the nutrition recommendations for cancer prevention. And I highly recommend that everyone who's listening go to this website. It's the American Institute for Cancer Research website, if you want really good nutrition information. And it's by specific cancer site. And they actually do continuous updates of the world research literature for each cancer site. And they have a patient language, and they also have a health professional language. So you can go to two different parts of the website, but this is great information. And what I'd like to do is just highlight the key points that I feel that most people would benefit from. The biggest bang for your buck, as I like to say. So we're going to focus on being at a healthy weight is number one. Then being physically active. Scott just talked about that, and Dr. Leapman. And then we get into diet specifics, eating a diet rich in whole grains, vegetables, fruits, and beans. Guess what? Those are all plant foods, right? And this one's pretty obvious. Limit consumption of fast foods and highly processed foods, high in fat, high in sugar, high in starches. And also limiting your overall intake of red meat. But a key one, which I'm going to give a little more detail on, is limiting added sugars from your beverages. Very key. Dr. Leapman did a good discussion on limiting alcohol consumption. I know that's kind of discouraging for a lot of people to hear, but it's very beneficial. And this one, I think I'm going to do a little more detail too, is do not use supplements to prevent cancer. I think people find that very surprising. So let's take a little deep dive on each of these 4 topics. So being at a healthy weight, there's a lot of misconception about what is a healthy weight. Now, some people who are treated for cancer lose weight during treatment and need to regain weight. That's very difficult to do. It's often harder to gain weight than it is to actually lose weight. I'm going to address here, most people have an issue of the need to lose some weight to get to a healthy weight. But what do we mean by healthy weight? Well, first of all, job one is to stop weight gain. Prevent further weight gain is often a victory. Just stop gaining weight and stabilize your weight. And the next thing is we have to reframe weight goals. And we don't use body mass index. I'm sure many people are familiar with that. I was told I need to be a BMI of 25 or less, but I'm at a BMI of 34. How do I get there? My answer is you don't. You don't use BMI as a guide. We know what it means to have clinically meaningful weight loss. And it's not BMI driven. It's actually percentage of weight loss from your starting weight. So a 2% weight loss is clinically meaningful, a 5% weight loss, a 10% weight loss. And let's just do an example of what that means. So if I take a man who's 5'11" and he's 240 pounds and just FYI, he's a BMI of 35. Well, a 2% weight loss is just 5 pounds. And he's already getting the medical benefits from that. But that puts him at a BMI of 33. A 5% weight loss is 12 pounds. And we, Tara and I worked on a research study together where we did intentional weight loss in breast cancer patients. And, getting a 5% weight loss takes work, but it's doable. And on average, our women, this was in breast cancer, lost about 6%. And we saw a 30% drop in inflammatory markers. It's huge.
And that's when you can start coming off your blood pressure medicines sometimes, and your diabetes medicines is around between 2 and 5%.
So it's powerful, but you're still at a BMI of 32. Now, here's the thing. The 10% mark is really what the body's willing to give up, not much more. And for this gentleman, that would be 24 pounds. He's still at a BMI of 30, which is still technically obese. See how wrong that is? Because he achieved the full medical benefit of the weight loss with 10% and 24 pounds. So when we're tracking individual weight loss, we don't use BMI. It's too crude a measure. It's useful for populations and screening, and but not for individuals, right? So I think what many people find this surprising. They're like, I can do this. This is achievable. And it's sustainable. And it's really tweaking what you're eating and tweaking your activity. It's nothing drastic, but it's sustainable. And that's what we always go for. How do we make these targeted changes to sustain a healthy lifestyle? Okay. So leaving that, and anyone has any more questions about that, you could put it in the chat room. But I wanted to focus on, and Dr. Leapman brought this up, about the role of plant foods in terms of the power of nutrition. It really is in your plant foods, the true power of nutrition. And the power is in the colors of your fruits and vegetables. I know people find that surprising. They think that's too simplistic. It's not. It's the beauty of Mother Nature. So the colors are what carry what we call phytonutrients. Phyto meaning plant. Nutrients only found in plant foods. They have very chemical sounding names like sulforaphane, alliums, flavonoids, but you don't have to remember the chemical names. You just remember the colors, because each cluster of color represents a whole constellation of phytonutrients. So if you look at how you're eating, and this is a visual way, but food is visual, think about what colors are you eating in your day? And you want the whole spectrum in your week. So it could be purple and blue, green and yellow, red and orange, white. All these colors carry these phytonutrients. And to, again, say that phrase, let food be thy medicine, which came from way back when, Hippocrates. This is the healing power of food. Is in the colors with these phytonutrients. These are the compounds that support your immune system, reduce inflammation. Again, they're not to replace any other treatments. They're meant to support your body and to nourish your body so that you then tolerate your treatments better and help manage the side effects. It's never a replacement. And I agree with Dr. Leapman. It's never 100% slam dunk. But when you start eating this way, you certainly feel better. The other thing with plants and in the fruits and vegetables, and it doesn't matter if it's a fruit or a vegetable. So you can accommodate all sorts of preferences and picky eaters. Everyone can do it. It has the vitamins and minerals and trace elements that everyone always seems to feel like they have to get in a supplement pill. But Mother Nature provides this to us in our fruits and vegetables. So this is Mother Nature's dietary supplement. Now, I would rather you get these nutrients from whole foods because they work in concert. It's not just a single nutrient that's in a food. It's what we call a food matrix. There are many compounds which enhance absorption and utilization of all the components in the food. So it's much better utilized when it comes from food, not a pill. And the last, get off my soapbox about plants, is that this is where you get fiber. Fiber only comes from plant foods, not animal foods. Fiber is a gift of health to your body. It helps maintain good GI health. But it's also, believe it or not, fiber is what we call a prebiotic. It's the substrate that your body uses to create its own probiotics in your gut microbiome. So your body knows what compounds it needs, and it creates it from the fiber in your diet. So the more fiber you provide in your diet, the healthier your gut microbiome is. So you can see how powerful, and this is often the component of people's diets that's really missing and really lacking. But I hope this should be the cornerstone of your diet. So you build your meals around your colorful plant foods. You can still have your animal foods, but again, like Dr. Leapman said, you want them low in fat. We limit red meat to 18 ounces a week. We do skim dairy, and you use your animal foods as a condiment. So it's kind of the reverse how we typically think of a meal. So again, I want you to, again, think color. Now, the next targeted areas is to look at sugar in the beverages that you drink. This is a hidden source of excess calories, but also manufacturers put added sugars into food where they don't belong. But you know what? It tastes better, so we like it. But it's not too much of this is not good for our body. Let me differentiate. Added sugars are different from naturally occurring sugars in fruit and some naturally occurring sugars in vegetables. That's fine because Mother Nature packages it with fiber. So that's fine. We're talking about just sugar added into foods where it doesn't naturally occur and it's put in by the manufacturer. This is such a problem that the FDA modified the food labels, nutrition facts labels recently to break out a line of added sugars. So now you can see on this example where there's added sugars. And if anything, if your homework for everybody is to, when you get off this call, go into your pantry and start looking at labels and look at these added sugars, and you'll be surprised how much there is. Your goal is to keep it total added sugars to less than 30 grams a day. Just as a point of reference, a teaspoon of sugar has 4 grams, is considered 4 grams. So, food labels put everything in grams and we always think in teaspoons. So, it's really like 7 to 8 teaspoons a day. Now, what happens if you're taking in a lot of this added sugar, it keeps triggering your body to generate more insulin to process this added sugar. And when you keep triggering your body to produce insulin, you create high insulin levels circulating in the body. And that's not a good hormonal state to be in. So what we're trying to do is normalize insulin levels by getting out this, glut of added sugars that's put into our diet. Okay, now lastly, to supplements, because people, when in survivorship clinic, people often, their first question is to me, what supplements should I be taking? Not what foods should I be eating? Somewhere along the line, people got the perception that supplements are better than food, or that our food supply is so devoid of vitamins and minerals that we need to use these supplements. And I really want you to rethink that seriously. If you build your eating around your plant foods, you'll be getting all the nutrients that you need, with few exceptions, but that would be something that would be diagnosed with your physician or your registered dietitian that could determine if you have any overt deficiency. That's very different. A deficiency is very different from the concept, oh, if some is good, more is better. It's not. So more can actually lead to toxicities. So I want to just put out some safety rules for supplement usage. First, everyone has to tell their healthcare team what supplements they're taking. People think they don't have to because you can just get it over the counter. It doesn't matter. It does. And I also encourage all the physicians on the call to always ask about supplement usage. When you're, it's just like when you get your medication history, get the supplement usage. And that if you are taking supplements, you really should know the dose that you're taking. A lot of people are unaware of how much. And this is a concern because more is not necessarily better. And there are some very large doses out there that actually then start acting like a medication. And this is something I think surprises most people. Do you realize that the FDA does not have to do any safety check on supplements before they come to the market? There's no before market safety testing on any supplement. So it's a bit of a wild west out there in terms of what you get in the bottle. Is it true to the label? Is it produced according to good manufacturing practices? The FDA only steps in if there's a problem. If a consumer reports an issue to the FDA, then the FDA steps in. Now, the reason why this is this way is because that's how the laws are set up. So this was set up a long time ago, 1994. So the laws are out of sync with kind of how supplements are being produced and consumed. It's a $1 billion industry now. And my big concern is that a lot of these supplements could possibly interact with your prescribed medications and your cancer treatments. That's why it's so important to report what you're doing with your healthcare team so it can be reviewed and make sure the doses are appropriate, or maybe it's needed, maybe it's not. But we have to bring this into the discussion. So with that, I'll stop here and be happy to answer any questions.
Stan, you're muted.
I was just going to say, Maura, you made some really great points about how, vitamins and supplements are really in our food. And if you're eating healthy, you don't have to run to the health food store and get X and Y and Z. I think you really make a lot of good points there, especially the fact that, we see this throughout medicine, that the FDA does not regulate supplements the same way it does drugs. And we really don't know what's in them. So it's really the buyer beware in terms of how you move forward on this stuff. So there's some questions in the queue here. I think Richard Gelb, who's a patient advocate, who I know very well, has just stressed to the group that, there are support groups that are available through Smilow Center. And it is important to seek out people who have similar type of problems that you do, because you can share your thoughts. It gets back to the concept of having face-to-face conversations about your common problems, decreasing your stress. And, he points out how it's important for you to advocate for yourself and to get involved with activities that bring meaning to your life. Thanks, Richard. I think that's a very important point. One of the things that I always wonder about, how does exercise and these dietary things, what's the mechanism of how they affect cancer? Or what's the thought process of, is it through the release or breaking down of free radicals? And maybe you can simplify it for the group here as to between exercise and nutrition. What's the thought process of how it actually either prevents cancer or prevents recurrence? Any thoughts with the group on that?
I do know when it comes to exercise, for example, that it does help. Obviously, it helps with your overall circulation, and it does help control your blood sugar. It helps control the triglycerides in your body, and so those are all contributing factors, right? And so to be able to control that from an exercise perspective, and again, too, the fact that exercise in some levels is an inflammatory process, but it also decreases the inflammatory process of the cancer itself, and so I think if you put all that together, I think that's the exercise contribution to definitely helping with the recurrence of cancer.
We've also looked at, things like DNA methylation status of certain genes that we know are affiliated with cancer. And we've looked at telomere length, which is something that shortens as we age and can also shorten in cancer. And actually, healthy diet and exercise after cancer, it appears to help lengthen telomeres. So I think the jury's still out on the exact mechanisms, but certainly inflammation plays a huge role, but it's not the only way that we're investigating.
Yeah, to the group here, DNA methylation is how the genetic material can be altered by your environment or by something you eat or kind of your weight, things like that. So all those things, I think, make they're a logical type of way to think of how they may affect cancer. Dr. Sand, do you have programs at Smilow that can work with stress in terms of lowering stress or processes between yoga? I always see things like midday about yoga programs for the staff. Do you have anything to offer to the general public for that type of thing?
Yeah, thanks for bringing that up. I keep trying to figure out ways to put these into the Q&A. So a couple things. First of all, we have an integrative medicine program, which actually we work very closely with Dr. Gary Soffer and his group. They have, since the pandemic, virtualized all of their offerings, including things like stress reduction programs and yoga and mindfulness. So if you just Google the Smilow Integrative Medicine, you should come up with their calendar, and every day there's something else that you can join virtually. And I think they have daily meditations that you can call into as well. The other thing that I put in the chat that's new and kind of neat is Dr. Jennifer Kilkis, who runs our Psycho-Oncology program, is running a 2-part series on self-compassion during cancer. And this is, geared towards, again, any person with a diagnosis of cancer. And I think really helping to frame coping skills and self-compassion is really important. Spent an hour saying all these things that we should be doing, and really baby steps matter, and also and recognizing that none of us are perfect and that we're all trying to do our best, and lending yourself some of that compassion can be really helpful in moderating stress. I put that in the chat as well.
I think that's a fantastic point. We see this very commonly with patients who are coming for a discrete period of treatment, be it a surgery or some intervention or radiation treatment, where there's so much stress and anxiety leading up to that. And there's not an easy solution for it, but I think that you raise really such great points about that prehab process. It's very often we see people coming to surgery or some treatment who've been, haven't slept really well for days and weeks before. And we know that has impacts on inflammation and might affect healing, might affect the recovery process. So I think that's something we really should continue to dig into. And I would encourage everyone to think about ways to sort of proactively address that. And I think that's something that we can continue to build on as well.
A couple of other questions in the chat involve specific foods like cheese, and I was actually going to mention fish as well. We hear a lot about fish oils and salmons and things like that. What are your thoughts on that more in terms of those two specifics?
Well, we do recommend trying to incorporate more fish into your week. We'd like to see 2 meals a week that are fish-based, salmon, shrimp, tuna fish counts. I get my tuna fish in by sharing it with my cat. So he gets some, I get the rest. He loves it, I love it. So 2 servings of fish a week. We're trying to go after omega-3 fatty acids, increasing that through food. The comment about cheese, there was also a dairy comment. I found that interesting that I like the way it was dated. 9 years ago, there was talk about eliminating dairy. And I think 9 years ago, the literature was saying that. But the current literature is, when they review all the body of literature, they're finding that dairy connection they're very inconsistent. The methodology of the studies don't line up. So I would defer to the MDs here, but I would say, dairy does, if you enjoy dairy, it does play a role. I like to keep it low fat for heart health. Cheese falls into that category. Who doesn't love cheese? It's one of life's great pleasures. So again, it has to be done in small amounts because it's very calorically dense, but also nutrient dense. So it's again used like a condiment. So used in sparing amounts.
There's also a question about red meat and Splenda, like artificial sweeteners. Do you have any thoughts on how much meat you can allow us carnivores to enjoy? Or
yes, the happy news is 18 ounces a week is considered heart healthy. Okay, so that you can satisfy that itch, and have your burger. Now, there was also a question about cooking. And yes, the cooking style matters. So particularly with meats, if you're grilling and you're if you like your meat charred, that charred part actually contains cancer promoting compounds. So we recommend not charring your meat, avoiding that. As far as artificial sweeteners, no problem. They really serve a useful purpose. But again, I would limit those, if it's something like a Diet Coke that you like to have, again, it doesn't mean you have 6 a day. That's too much. But, 1 a day, if that helps, that's fine. But keep it in a healthy place, but they're safe.
And one other question, you showed all those beautiful colors of food. You got your reds, your yellows, your greens, your whites. Is there, just for the group here, is there any particular one that's better specifically for prostate cancer or any other? We can also answer questions not related to prostate cancer, but is there any one specific for one versus the other? I don't know if Dr. Leapman wants to comment on tomatoes and prostate cancer. That was a big thing dating back a while. Where does that stand now?
Yeah, so there was a lot of enthusiasm about lycopene, which is something found in high concentrations in tomatoes, and that was really found in observational studies when you looked at people who participated in studies where they reported their intake of certain foods over time, and then we assessed their risk of developing prostate cancer later in life. There has been a connection between tomato intake and prostate cancer risk and prostate cancer outcome. And the thought about what's in tomatoes, or this lycopene compound, which appear to have antioxidant properties, which may be connected. So, but some of the studies have been mixed, and so I don't think it's a slam dunk either to say you should go out and get lots of tomatoes. But it seems like a wise choice to incorporate the reds into your diet. So if you're looking for to fit that red or orange category, it's a great choice. How much does it modify that risk? It's a bit hard to say, but a good choice to integrate. The other are sort of the greens. So green leafy vegetables. There was a lot of enthusiasm about celery and cruciferous vegetables, and sometimes you'd find urologists, like eating lots of celery. There was one guy I know in particular who you would always find him with celery, and who was really moved by that data. I think that's a great choice as well. I love celery, and I think it's a great choice. You're going to get your fiber there. You're going to get your greens. And Maura, I'm curious to hear what you think about that.
All good, all good. I think the research, the nutrition research, is moving away from looking at food as one nutrient at a time, or one component. The nutrition research is moving in the direction, the overall pattern is important. And so this, what we call predominantly plant-based pattern, kind of encompasses all these nutrients. So you can't really, pull out one and say, this is the superfood. It's really the balance of your nutrients that matters. And that's when so one way to do that is you visualize your plate. If you look at your plate and say, well, what foods come from plants and what foods come from animals? That 2/3 of your plate should carry foods that come from plants and 1/3 animals. And that's kind of the visual of a predominantly plant-based diet. So I like to frame it up as broadly as possible, because everyone has so many different cultural foods, cultural practices, household budgets. Some people, only like, certain fruits, certain vegetables. That can all work. So there's lots of ways to eat well. But if we kind of broaden it up to overall pattern, predominantly plant-based, all the colors, you fill in the specifics, then it works.
We have an interesting question on getting back to exercise and prostate cancer. There's a question about someone who had a total knee replacement and was told not to run, and was told also not to bike because of prostate cancer. I'd like to know if you feel that is true about prostate cancer patients, about not to cycle. And what are your overall thoughts with that, Scott?
Yeah, I don't see a problem with it. So I'd be curious, Dr. Leapman or Dr. Honig, if you have any research that is, goes one way or the other. I distinctly remember working with a survivor of prostate cancer 2 summers ago, and his goal was to ride the Closer to Free bike ride. And so that's what we worked on. And so I know, and as far as I knew, he'd had no restrictions. If you have any restrictions because of surgery or radiation, that's something else. And then obviously, again, you want to work with a physical therapist to figure out ways around that. As far as exercising after having a total knee replacement, yeah, we probably tell you not to do any like high impact forms of exercise, so maybe not running, but definitely walking counts. I mean, any exercise is good exercise, right? Any movement is good movement. If you wanted to incorporate that into high intensity training, I know that in our rehab clinics, and I know in a lot of the gyms, they have a device called a New Step, which is basically an elliptical machine, but you're seated. And I use this machine all the time. I use it a lot for my folks who maybe have metastatic disease, if they have metastatic disease to the bone. It is a safer way to be able to exercise, and we can do high intensity training on that piece of equipment. So, and then because you're in a seated position, it's not a full weight bearing like if you were trying to run on a treadmill. But we can play with intensity, and we can play with duration and all that sort of stuff. So so there's definitely ways around that.
Dr. Leapman, any thoughts on bicycle riding and prostate cancer?
Yeah, I was going to say that, it's something probably to check with your doctor about your specific situation or circumstance. In general, during active treatment, immediately following treatment and during treatment, it might be something to refrain from. But after most treatments, bicycle riding or saddle riding may be okay. We've had patients who transition to a wider seat. If cycling is something you like and enjoy, we can almost always find a way to help you incorporate that back into your lifestyle. So sometimes it's modifying the seat. I've also had a number of patients who've moved to rowing. Now, again, so rowing can be really great, a great way to get your heart rate up as well. But again, it's sort of finding something that you like. So I think in general, check in with your doctor about, the specific conditions and how you might be able to modify a bicycle if that's something you want to do.
Yeah, and to that point, Dr. Leapman, there's something called going for a bike fit. And so some of the bike shops offer the opportunity for you to bring your actual bike in, and they can play with the different types of seat height, seat pitch, right? That can all be adjusted. So if you go, and I know of one particular bike shop who the bike fitter is actually a physical therapist. And so yes, so there are ways around that to be able, but again, you want a professional eye to be able to help assess that.
Super important point, Scott. You're totally right. I was going to say that, but the bike fit is so important for everyone, but especially to help reduce the risk of injury, to improve the ergonomics of riding.
And it gets down to really personalizing your care to your particular situation. So if you've had surgery, you're probably not going to ride a bike in the first 3 or 4 months. But I think once you kind of maintain your new normal, my sense is that, like you said, anything that's going to get you out to do something that gets your heart rate up is really what you want to do. Scott, another question that comes up is what kind of exercises for people who've had prostate cancer that may have had surgery? We talk about Kegel exercises, but we don't go into the details like you can. Maybe you can give a general, like, basic description of what a Kegel exercise is, how you can do that to control your urine for the group.
Yeah, that's a great point. And I would say that, the Kegel exercises are one exercise, but again, physical therapists, we can design a program that is going to be able to have you do a variety of different exercises. Because I think what you're talking about is being able to strengthen the lower core muscles, to be able to strengthen those pelvic floor muscles. And honestly, what I start with is I start with diaphragmatic breathing. I know that sounds really, really simple, but to be able to engage the diaphragm, to be able to control the intra-abdominal pressure, and most of us don't know how to breathe right anyway, right? Like a lot of us, we use our upper chest, or we use our back, to breathe, and we're not really engaging our diaphragm. And so that's the first thing. That's the first place that I start, is to have somebody either lay down or in a seated position, one hand just below the belly button, and one hand on their chest. And I say, I want you to picture a balloon underneath your belly button. So when you breathe in, you're filling that balloon and you want your hand that's over your belly button to rise. You don't want the hand on your chest rising. That way you know that you're engaging your diaphragm. So I start there, actually. And then from there, I can incorporate other exercises, simple exercises that don't require any equipment, like bridges, and be able to do supine marches, and to be able to build on that and to build more progressively challenging exercises to help build up that pelvic floor. So Kegels are one potential exercise to use, but I would say if you're gonna, tell your patients that, you want them to work on an exercise, I think breathing is probably just as important and a great place to start.
Those are really great points and points I think we're going to bring back to our patients, both in the clinic and I think to the group here. There's another question about, are there any disadvantages in consuming fruits and vegetables through a smoothie rather than eating these vegetables, eating them as opposed to pureeing them? Good question. I know that it comes up whether you cook them or not, as opposed to raw. Maybe you can address that as well.
Okay, so it depends if you're doing it yourself and you're kind of just changing the texture and keeping all the fibrous materials within the smoothie. It's equal to eating the raw fruit or vegetable. It's if you're using a machine that extracts the pulp, that's where you're taking out a whole boatload of nutrients with that extraction. So you're taking out the fiber, you're taking out a lot of vitamins and minerals. So, as long as you're keeping all of the materials within the smoothie, it's fine. And the question was cooking versus raw in terms of nutrient content. I guess that's the intention.
Yes.
Yes, you can. Cooking does, and different techniques does promote some nutrient loss. So let's say, for example, you put in a beautiful head of broccoli and you put it into a pot of water and you boil it. A lot of nutrients are going to leach out into the liquid. So that type of cooking definitely removes a lot of water-soluble nutrients. So we don't recommend that type of cooking. We recommend steaming. You put a basket in the pot and you put the water underneath it and you boil the water and the steam cooks the vegetable. So that makes a difference. Very high heat tends to destroy nutrients. So, keeping cooking times shorter at lower heat and out of water, kind of the rule of thumb.
Great. All right, I think we've answered all the questions. And I mean, for me, this has been a really valuable learning experience just to hear what each one of you has to add. And I think having a surgeon and a survivorship specialist and nutritionist and exercise really covered a lot of ground in terms of diet and the good, the bad, the ugly. Exercise is good no matter what. We have a great survivorship clinic where we offer virtual stress reduction. And if you found this interesting, then next week we're going to have a series on fear of recurrence. We have 2 more sessions, one on sexuality, intimacy in the prostate cancer patient, and one on fertility. So I thank everyone for joining us tonight, and look forward to having you join us next week. Thanks, everybody.
Thank you so much.
Okay.
Thanks for having us.
Good night.
Okay. Good night.
Good night.